Well, thank you for joining us this afternoon. My name is Richard Spellasi, and I'm the Registrar of the College of Alberta Psychologists. Prior to beginning our information session tonight, as one act of reconciliation, I would like to take a moment to give our land acknowledgement. It is with respect and in the spirit of reconciliation and truth, the College of Alberta Psychologists honor and acknowledge that here in Alberta, treaties 4, 6, 7, 8, and 10, as well as many unsigned treaties, are the traditional and ancestral territory of many diverse Indigenous peoples. Namely, they are the Kainai, Piikani, Siksika, Cree, Dene, Saulteaux, Nakota Sioux, Stoney, Tsuut'ina, Inuit, and the Métis Nation. We acknowledge and give thanks to the many First and Métis Nations and Inuit peoples who have lived and cared for these lands for generations, and the many others whose histories, languages, and cultures continue to influence our vibrant community. We are dedicated to ensuring the spirit of all treaties are honored and respected. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. For those of us joining us today, please note this information session will deliver similar information as the previous town hall meeting on November 18th. As stated previously, this is an exciting time for both CAP and our profession. On September 30th, 2021, CAP launched our new member management system, affectionately referred to as MMS. The MMS is a digital platform designed by Softworks Group, also known as Alinity Softworks. It is intended to support CAP's digital modernization goals and our desire to move toward a paperless environment. The Alinity platform was selected after extensive needs analysis was conducted by an independent third-party consultant. This was followed by a request for proposals process where Alinity was selected as the successful candidate. Some of the perceived strengths of the Alinity platform include their Alberta location and their track record with other regulated health professions, both in Alberta and beyond. Their references were also stellar. The Alinity platform will modernize most aspects of college administration, from registration applications to finances. While the college has existing member and professional misconduct databases, these will now be housed in a more interactive, integrated manner. The overall objective is to allow members increased ability to actively manage their CAP profile. For example, as Troy Jansen will soon discuss, to make simple changes to their supervision plans, such as practice location and population served. In addition, the Alinity program provides for increased internal reporting. The MMS will also provide a digital platform for the much anticipated continuing competence program, commonly referred to as CCP. As Dr. Dina Martin will elaborate in our town hall, our long-awaited CCP is set to be launched on February 1st, 2022, in conjunction with the annual practice permit renewal cycle. Launching of the CCP is also an effort to bring CAP into the modern era, as most self-regulated and many non-regulated professions have continuing competence requirements. It is typically viewed as a quality assurance mechanism, ensuring self-regulated professionals maintain their competency by keeping pace with the evolving nature of the science and research underlying their clinical practice. In my opinion, it also suggests a profession's level of maturity. An additional feature of the MMS is financial management. The MMS will allow applicants and members to pay application, examination, and registration renewal fees. It will also allow applicants and members to obtain receipts. Internally, the MMS will be linked to our accounting system and simplify financial entries. This will be particularly helpful for timely financial reporting and forecasting. Overall, CAP is excited by the increased opportunity for member participation and interaction with the professional profile, and it will gain many administrative efficiencies for all. Now I would like to turn to the first half of today's town hall meeting that is directed towards continuing competence. As many of you know, college CCP has long been delayed because of the lack of regulatory approval. Given this delay, CAP sought a legal opinion and a decision was made to develop a standard of practice. More recently, Alberta Health adopted this strategy to address the same problem for several other health professions. This may result in further changes as recent legislation is being rolled out over the course of 2022, and this may require a more extensive consultative process. Notwithstanding, CAP is of the view that we have the regulatory framework in place to move forward. Any future changes will be done in a staged and transparent fashion. It is, however, believed that our current program parameters will likely remain the same. Given this understanding, I would like to now introduce Dr. Dina Martin, who will provide an overview of CAP's CCP. Dr. Dina Martin currently serves as CAP's Assistant Deputy Registrar and Director of Professional Guidance. Dr. Martin's career has focused on competency development for those in the helping professions. Her teaching portfolio includes undergraduate and graduate teaching in the areas of professional ethics and the law, counseling, leadership, research methods, and statistics. Over to you, Dr. Martin.
Oh, thank you. Thank you very much, Richard. I'm just going to go ahead here and share my screen and see if we can't get us going here. I just want to say thank you to everyone who's made time to come here tonight. I can see our numbers are quite high, similar to last time, and it's great to know that this is important to you as it is to us. So we have a full hour of content planned. So there's going to be a combination of different things happening. And so we're going to invite you to use the Q&A chat, which is on my right of the screen, to ask your questions. And if you're going to chat with your colleagues, feel free to use the chat side. With the Q&A, you can upvote by clicking on a question, and that will move the question up to the top of the screen. We've got some fantastic staff answering questions in the chat as we go along. But I would just ask you to hang in there. We've got a lot of content to cover. I'm sure we're going to address a lot of your questions, and we will have time for question and answer as we go to the end. Okay, so let's just jump on in. Today's agenda, it's pretty ambitious. We would like to first introduce the program. We'd like to spend a little bit of time sharing the CCP resources available to you right now if you haven't had a chance to check out the Continuing Competence Program webpage yet. And we have a new video today. It's not quite perfect yet, but we will show a 10-minute video showing the CCP online MMS system. So you have a good feel of what that program is going to look like when it opens up in February. And of course, time for question and answer. So as Richard just articulately discussed, it's time for a new direction. There are external factors happening, government reform in the area of regulation. Some of you recently completed the Bill 21 training, Preventing and Addressing Sexual Abuse, an example of regulatory reform. So there's changes at the government level in asking regulatory colleges to take on some structural changes to their programs, including the Continuing Competence Program. And as Richard spoke articulately about, there's internal things that are happening at the college that have been fantastic. This transition to the new MMS, and as well, Kathy Semchuk has led the redesign of the web page, which has been quite exciting and refreshing in the content. So I'm going to ask Kira to provide us with the introductory video as a start to kick us off here.
Welcome to the College of Alberta Psychologists Continuing Competence Program. For the remainder of this presentation, we will refer to the College of Alberta Psychologists as CAP and to the Continuing Competence Program as CCP. We developed this video to provide helpful information about the role and design of the CCP so that our regulated members are aware of the annual requirements for the profession. The information contained in this video is from the CAP CCP Member Guide. Note that this program guide, along with additional resources such as FAQs and technical how-tos, can be found on the Continuing Competence page on the CAP website located at www.cap.ab.ca. CAP's CCP is designed to meet Section 50 of the Health Professions Act regarding continuing competence for all regulated health professions in Alberta. The program contributes to public protection by helping ensure the public receives safe, ethical, and competent professional services from our regulated members. The CCP also elevates the profession's reputation by promoting the pursuit of excellence in professional practice. When designing the program, efforts were made to ensure the program was both practical and flexible for all, meaning for our members, our administrative staff, and also for those who will participate in the professional review process. This program formalizes and complements the profession's commitment to continuous learning and ultimately public protection and the delivery of safe and ethical psychological service. CAP defines competence as a multidimensional construct that is generally considered to be comprised of the following components: knowledge, skill, judgment, and diligence. In regard to knowledge, psychologists are to maintain and ensure the accuracy and currency of the scientific theories and evidence relevant to their practice. Moving to the concept of skill, psychologists monitor their ability to effectively apply scientific theories and methods in their practice. Judgment is defined as psychologists applying their knowledge, skills, and experience in a way that is also informed by professional standards, laws, and ethical principles. Lastly, diligence means that psychologists carefully and persistently attend to their knowledge, skills, and judgment as applied in professional activities, being careful to prioritize the client's needs. This color diagram depicts CAP's CCP 4 core continuing competence areas. In total, members will complete a minimum of 24 required hours and participate in 3 wellness activities. Let's break this down further. Starting at the top right corner of the diagram, members are to complete a minimum of 8 hours in scientifically supported professional practice. The focus of this area is to ensure members acquire and maintain their theoretical and scientific knowledge base appropriate for their professional activities. Please refer to the CAP CCP member guide for examples of activities that fit in this area. Next, members are to complete a minimum of 8 hours in the activities related to furthering their knowledge and application of ethics and jurisprudence. The focus of this area is to ensure psychologists acquire and maintain their knowledge of the professional code of ethics, standards of practice, practice guidelines and alerts, case law, and legislation relevant to their practice. In the area titled Professional Engagement, members are to complete a minimum of 8 hours connecting with other psychologists on a routine basis to foster and instill a commitment to both the profession and the practice of psychology. This may involve being a member of a professional association, volunteering with a regulatory body, and many other activities. Again, please see the CAP CCP member guide for examples. The remaining quadrant addresses wellness. The intention of this area is to ensure psychologists actively engage in activities that promote professional well-being. For this area, members will identify and participate in 3 wellness activities as part of their continuing competence program. In summary, members are to complete a minimum of 24 required hours and participate in 3 wellness activities annually. There are 3 explicit steps to participating in CAP's CCP. Each step was developed to answer a question that would move a person logically through the CCP process. In step 1, members describe their practice and fill in fields related to the branch of psychology, professional activities, practice context, and client focus. In step 2, members write personalized SMART objectives across the 4 core categories of continuing competence. And finally, in step 3, members record and evaluate their CCP activities. Members are encouraged to keep their practice profile, goals, and CCP activity records up to date throughout the year. They are also encouraged to plan their CCP activities in advance of each practice permit renewal cycle. Administratively, the CCP directly aligns with the practice permit year, starting April 1st and finishing March 31st. At their first practice permit renewal, members must complete steps 1 and 2 prior to receiving their practice permit. For all subsequent practice permit renewal years, members must complete steps 1, 2, and 3. All regulated members are required to participate in CAP's CCP. This applies to fully registered psychologists, registered provisional psychologists, and members who may hold registrations in more than one profession and/or who are registered in other jurisdictions. Exemptions to participating in the CCP is limited to those on the courtesy registrar, those who are on parental leave, and those who received approval from the registrar directly. CCP audits are conducted annually to confirm member engagement and may consist of a computer, administrative, and/or professional review of the member profile. Each year, psychologists will be required to submit a declaration of program participation as part of their annual practice permit renewal. A percentage of these CCP profiles will be selected for review as a result of random selection, a late or incomplete submission, or a request from the complaints director. As part of the audit, a psychologist may be asked for clarification, supporting documents, and/or enhancements or revisions to their CCP profile. When the audit is complete, psychologists will be notified and receive feedback on their continuing competence profiles, including further instructions if required.
Thank you for that. I'm going to go back to sharing my screen here. That was a lot of information. So we're going to come back and we're going to revisit some of the key points that I think folks are interested in hearing about. So going back here to the 4 categories of continuing competence. So this is the model. This is available to you right now on the CAP website if you want to have a look. This is we're quite curious to see how people are going to, let's go back here, are going to respond to it. And then I think you can approach designing your continuing competence goals using a top-down approach or a bottom-up approach. And let me talk about that a little bit more. From a top-down approach, what I'm seeing is that people would take these 4 areas and write their goals, and they'll be all neat and tidy, and everything will fit really, really slick. And so if we go to the web page, there are some examples for you here, and where I've written some really discrete learning or goal continuing competence objectives that fit nice and tight in each one of those areas. So an example here is I'll learn new techniques on supporting children in trauma by attending a 2-day conference on trauma by January 30th, 2023. That would fall under scientifically informed professional practice. It would be about 12 hours. It would fall under professional training, and it would be at a conference. These are some of the descriptors that you'll see will come forward later. So we have some examples I'll go through here in a bit, but my experience, sorry, I'm just gonna back up here if I can do that. What my experience was after the last town hall is people say, well, I do this, where does it fit? So that's going to be the bottom up approach that we're talking about, where people want to say, we know that a lot of our members, most of our members are engaging in professional continuing competence, professional development on an ongoing basis. And so it makes sense that you'd ask the question, where does this fit? And just straight off the bat, I want you to know that it can fit in a variety of places, in that some of the activities that you're doing can fit under professional engagement or scientifically supported practice or ethical and jurisprudence practice. And you will have your discretion in terms of putting it where it fits and building a program that captures what you do in a way that reflects you, much like our supervision plans are individualized to the provisional. Your continuing competence plans are going to be individualized to you. So please don't worry too much about where things fit, in that things may fit in more than one spot, and that's just inherent flexibility that's been built in. So, but I know we'll get a few questions on that and we can speak a little bit more. So the next one was the 3 steps, describe, design, document. We'll watch a video in a few moments on how to do that in the MMS. So you'll have a direct experience of that. So again, coming back to some of the sample goals, you'll have goals in each of the areas. You'll have a minimum of 1 goal and up to 3 goals. In the area of wellness, we are asking for people to have 3 goals. But in the other 3 areas, you may have 1, 2, or 3, depending on what works best for you. And again, if you go to the webpage, there are examples. There's a handout with each one having 3 examples, or 3 examples for each of those 4 areas. So hopefully this will be interesting and informative. In terms of the types of activities that are recognized by CCP, we'll definitely, academic coursework, professional training. So that would be attending, professional training looks like attending webinars or psychiatric rounds at a hospital, or professional development activities put on through a local PAA or CPA or APA. We'll recognize self-directed studies. So there's a lot of members who do their own research, who belong, or networked into a larger community, and making sure that they're staying on top and have really ambitious reading schedules. And so we'll recognize self-directed study. And self-directed study could occur individually or it could occur at a group level. So there'll be opportunities for that. Research and scholarship. Professional leadership and engagement. This is the one that I think is really the most robust. And this one talks about supervision and mentorship and peer engagement. And again, for definitions on all of these, please access the continuing competence program manual that's available on the website. And we also have wellness and healthy lifestyle. And another category, we know we don't have it perfectly defined. It's a growing year, so please be patient with us as we grow, and we'll be patient with you as we get this right. And it will take some time to get these fitting perfectly, but we feel like we've got a fantastic start to the framework. So these are the CCP activities that'll be recognized. Again, this is a one-page handout as well as an appendix in the Continuing Competence Manual, and you can refer to it. And it's a fantastic resource to help talk about kind of the main descriptor of the activities, and then there's some more sub-descriptors. And then there's actually a column that helps you identify what documents that you might want to collect or develop to be part of the audit process in the Continuing Competence Program. So don't hesitate to have a look there. So speaking of that, let's just talk right now about the CAP webpage. I've got two pictures on here. I'm going to zoom in on each one of them. One of the things that we're learning, this is going straight to our phones. So if you're not using Google Chrome, that's going to be one of those tips and tricks I ask you to take away from today. The latest Google Chrome gives you the best experience both on our website and on the MMS. If you're not using Google Chrome, you may be using your phone, or you may be using Safari or something, or Firefox. You will have an experience, but it just might not be the same. And this is an example of what the CAP webpage looks like on your phone. And so instead of seeing it as a tab across, you need to go to kind of this little hamburger at the top here and have a look at it. And here you can see that the continuing competence, if you're looking on Google Chrome on a full screen on a computer, you'll easily be able to have a look and see it there. So what's on our CAP webpage? Fantastic question. We have a ton of CCP resources that have been developed for you folks. We've got a CCP program manual. It's in the process of being revisioned. There's been a few tweaks to our program since the last town hall. So look for a final copy of those come February 1st, but don't hesitate to have a booth through them right now. Same thing with the FAQs. We have a good, I think there's 6 or 7 pages of questions there. And that will be updated as well as we get closer to February 1st. We have lists of sample goals and activities. We also have a link to the latest CAP monitor. If you haven't had a chance to check that one out on Continuing Competence, please do take a look. As well, on our webpage, we have an implementation survey. So after today or during today, if you want, or after reading some of the resources and you want to give us some feedback, we're going to keep this survey open all year so that you can help connect with us and tell us what we need to be paying attention to that would be beneficial to you. And we've also have an opportunity for question feedback, so a direct box that sends email to us. And then we also have some more CCP resources that are in development. And so we've got one that is going to be the how-to tech guide. So it's written, it just needs a little finessing. And then we also, I think we're going to develop one more resource on how to write SMART objectives. We'll see where we go with that and time permitting. Another thing to pay attention to on the website that I'd like to direct your attention to is the dates. So we didn't have dates on the video because we want to evergreen that video and keep it up for as long as possible. But on our web page, we've got the actual dates for the current time period. So here you can have a look on my left. It says February 1, 2022. This is when access to the Alinity system is going to open. It's part of the practice permit renewal process. And you can see what steps need to happen there. April 1st, things shift again. So this is when access to the step 3 becomes available. And this is where members can start amending their practice profiles and goals throughout the year and adding their activities. And then come around to 2023, February 1st to March 31st, what will happen there is we'll be looking at wrapping up step 3 for this practice permit year, and then looking forward to next year, completing steps 1 and 2 for the 23-24 practice permit year. So this is a fantastic place if you get confused or you want to mark up your calendars. These are the dates that you want to pay attention to. Okay. I'd like to go ahead and show the second video now, Kira, if that's something you can help me with.
Welcome. This video will provide an introduction to the CAP Continuing Competence Program. To access the CCP, click on the My CAP login located at the top right-hand corner of the CAP website. You will be taken to the CAP login screen where you can enter your email and your password. So pressing this login button will take you to the main page of the member portal. Here you want to go to the left-hand side and locate the My Learning tab. It's about 3/4 of the way down. When you press My Learning, it will take you to the My Continuing Education, where you'll see your program plans listed according to registration year. So for the year 2022-2023, when you enter, you'll simply add the plus sign and add a program plan for that practice permit renewal year. In our situation, we're going to use Dr. Anna Freud's 2021-2022 program profile. So before we get into the CCP program itself, I'd like to spend just 2 quick seconds talking about navigating the system. So first and foremost, there are 5 pages here. There's 5 tabs that you can access your program from. The first page is step 1. It's all about your practice profile. And then each of the 4 categories has its own page, which you can access simply using your mouse and clicking. So if you don't know where you are on a page, you can simply go up to the top. You'll see that this tab is lit up, and you'll know that, oh, I'm on the professional engagement page. Same thing at the bottom. You can navigate the pages simply by clicking on these navigational tools, and it will take you from category to category. While I'm down at the bottom of the page, I would also like to show you this Save for Later button. This is really important that whenever you complete a page or whenever you decide to navigate away from the Continuing Competence Program, that you simply push the Save for Later button. This is really important. If you don't do that, your work will be lost. So again, whenever you go from page to page on the Continuing Competence form, simply push the Save for Later button and you'll know that your work has been backed up because you will get a notification. As described in detail in the Continuing Competence Program Manual, there are 3 steps to participating in the CCP. Step 1 is to describe your practice. This occurs on the first tab titled Practice Profile. Pressing here, you'll be greeted by a set of instructions. It's important to read these instructions as well as the Continuing Competence Manual, along with the How-To Tech Guide, in order to understand all the different aspects of each step. This video is simply designed to navigate around the computer system so you're familiar when you sit down to enter your program. So here we go. Practice description. Branch of psychology. Select the branch of psychology that best describes your professional practice. So you simply go select from the drop-down box what area of psychology that you practice in and enter the percentage of your practice. Please use whole numbers, and please make sure that each section under each heading, so branch of psychology is 1 heading, adds up to 100. Professional activities will also add up to 100. Professional practice context needs to add up to 100, and the client focus needs to add up to 100. So let's go a little bit more detail into professional activities. So in professional activities, I may do some formal assessments. That may be 60% of my work. I'd like to add another professional activity. Perhaps I do some consultation. That's a good 25% of my work. And then perhaps I do some interventions in that I do some psychoeducational type workshops. So I'll go here to intervention, and I've got 60, 70, 80, 85. That means I need 15% more, and I'll put my intervention areas at 15. So again, making sure this adds up to 100, and that these drop-down boxes capture the entirety of my practice for the last practice permit year. Under professional practice context, this is the setting in which we provide services. So I may provide some of my services in a school system, and then perhaps I'll add, clicking on this blue box, some of my work is in a private practice setting. And then actually perhaps some of my work is, let's see here, perhaps in the health facility working with the hospitals and children who are in care. So again, if I decide, you know what, that's not really true, I didn't, I like to do that work, but I haven't done a lot of that in the last year, I might just go ahead and delete that and then bump this back up to 40%. Scrolling down to the bottom here, the client focus. So here, which is the developmental stage of the client group with which you work. So perhaps you work mostly with children, and that's 80% of your practice, and you do individual assessments. And then perhaps you also do some consultation work with the adults, with the school, with the teachers. That's 20% of your practice, and that'll be organizational and with individual school teachers, and perhaps maybe with the families, the parents of the children that you're working with. So that is step one in its entirety. You simply use drop-down boxes and percentage of practices to capture your professional activities for the past practice permit year. And of course, we go to the save for later so that we know that it is saved to our profile. We got it for notification, and we can move on to step number 2. In step 2, members design their continuing competence goals. In each of the 4 categories found across the top here, members to go in and to enter information using the template drop-down boxes provided. So, starting with professional practice, each area has a little description of the requirements for that practice area. Then they have a goal section. The goal section has 3 steps in it. First, members are to self-assess where their knowledge is at this point, if they're acquiring, maintaining, or developing. Second is an area for them to actually physically enter their goal. And third, they select their anticipated activities. So in this area, it's going to be scientific professional knowledge and practice. I may be looking at acquiring some new skills. My goal, which I've cut and copied, is I'll participate in a 2-day workshop on telepsychological assessment practices through Pearson in May 2022. And in my anticipated activities, that's professional training. I'm participating in a 2-day workshop. And I'm also going to do some self-directed study on this, in that I'm going to do some pre-reading and probably some post-reading follow-up. So recognizing that it's a 2-day conference with some self-directed study, I will easily meet the minimum 8 hours required for this core category. So that is it for step 2 under professional knowledge and practice. I'm going to scroll to the bottom, select save for later. I get a notification that it's been saved, and then I'll go to my ethics and jurisprudence tab. Again, I'll determine my activities. I'll enter a goal, I'll select my anticipated activities, and then I'll move through to professional engagement. And lastly, I'll be on the wellness tab. The wellness tab looks a little bit different relative to the other 3 tabs, in that members are required to have a minimum of 3 wellness goals for the upcoming practice permit year. They're not required to select activities, but they are required to have 3 goals. So you'll notice that there's actually 3 goal boxes for people to enter their information into. And you will not be able to submit your continuing practice program plan unless all 3 goals have been entered. So we come to the end of step 2. We hit save for later. If you are in the registration process and you would like to move on to paying for your practice permit, you can hit the submit button. Or if you're still going to finesse and revisit your goals, you can hit the save for later. When you go navigate through these through these tabs, your work should be saved and come back up for you to review. That is it for step number 2.
I'm back here. I'm just going back to sharing my screen, wondering how you guys are doing. This is a whole lot of information coming at you. I've got one more slide, I think, before we go on, double checking here, one more slide, I think, before we go on to straight on question and answer. So if you'll bear with me, I just wanted to offer you some tips and tricks. Recognize that this is new learning for all of us. Connect with your colleagues and learn together. Give yourself time and space to move through. You're not only learning the program, but you're also, some of you will be learning a new online portal system as well. We encourage you to please make use of the resources available. We've worked hard to develop them in anticipation of what you might need. If there's something that you don't have that you think would be helpful, don't hesitate to reach out, and we'll see if it's something we can put together. And a quick tip is to write your CCP goals on paper, so that if you start with the online program, as you pardon me, as you saw, there's a lot to learn there. So if you've got your goals already written, not written down on paper, but typed out, it'll be just so easy to cut and copy them and just make that CCP program itself more of an online tool as opposed to where you do your thinking and planning. In the technology side of the house, we talked about this already a little bit. Use Google Chrome as your browser, highly recommended. Other browsers will work, but you won't have all the full features, which may be important. Point number 2 there, when in the CCP, stay in the CCP. So I was going to demonstrate this in the video, but our video is getting so long already, is that save. If you go out, you start looking at your profile or somewhere else, your work will be lost. That's save your work for later is an incredibly important button. And note that you only have 20 minutes per login. So the CCP page itself isn't active, but when you press your buttons to save and that sort of thing, that keeps you able to keep working in the program. Otherwise, it will log you out. So again, doing some of that thinking on the front end before you even enter the program will help you move through that 20 minutes quite easily. And then the last thing is be cognizant of scheduled maintenance. So, I didn't have a demo of that, but maybe I'll snag one. Pardon me, next time we get a notification. But when you log into your portal, like if you say, okay, I'm going to work on this Sunday night, well, then on Friday afternoon, just log into the MMS, MyCab login, and see if there's any planned maintenance, because we don't want you to miss out because the system's being upgraded or what have you. And on the back end of that, we know that upgrades, I think, happen around mid-month, but things might also happen at the end of the month. So waiting to the last minute's not going to be a wise step. I don't want to be your mother in any way, but the earlier you get it done and play around with it, I think you'll be happier and more confident in submitting it. The last slide I have to offer before we go straight over to question and answer is, I just really want to make mention, it takes a team. I'm so thankful for the CAP Council members, not just the existing ones who've been fantastic and supportive, but also previous board members who've really laid the foundation so that we could arrive at this place in our profession. Practice Advisory Committee, my PAC committee had a sneak peek and gave some feedback back in October. Formal council members were approached and gave feedback on the CCP, which was great, as well as colleagues from other colleges and CAP staff. Some of the feedback that we've gotten so far is that they like it, already do that. It looks straightforward. So we're hoping that that's your experience as well. So I'm going to stop sharing. Richard, are we ready to jump into the question and answer?
We are, Dina. So thank you very much for that presentation. And I know it was a lot of information for people. And again, it's all on the website. There'll be another information session in January. You can look at the web page and seek out information there. It will all come together, I'm sure, more clearly during the practice permit renewal time period between February 1st and April 1st. So let's go to some of the questions. We got a question about parental leave. There is an exemption for parental leave for people to not participate in the continuing competence program. However, if those on parental leave would like to participate, it's optional. And that's totally up to them and their circumstances. Some individuals will still be doing consultation with colleagues and those kinds of things, but there will be no requirements during the year that a person is on parental leave. So that was a question. One person asked about sounds costly, especially if you're a provisional psychologist. You do not need to participate in the step 2 period, documenting your continuing competence for your first year. Continuing competence is tied to renewal. So simply the first year, you're doing steps 1 and 2. The second year, you're doing steps 1, 2, and 3. So certainly during your first year, you're not required to do that. Now, one of the reasons why it is a requirement of provisional, because some individuals take several years to finish their provisional status, so that if we said you wouldn't have to do it when you're provisional, given our current regulations, we do have individuals who go beyond the 5-year time period. And certainly we feel that it's reasonable for psychologists to participate in continuing competence, and also to As a provisional, you are being integrated into the profession, and this is considered one aspect of being integrated into the profession. There was a question about, I wonder whether I need to have 24 hours and 3 activities before April 2022. No, again, you need to simply complete steps 1 and 2, so you won't have to have hours before April 1st. The hours start to count after April 1st. One person asked if they completed training this year, can they contribute it, add it to their training next year? No, the counting for training starts after April 1st, 2022. Another person asked about, will CCP hours be also counted towards provisional hours? Now that's an interesting comment, and the issue here is the principle one should focus on, is it double dipping? That's one should look at. So if you are getting our credit for hours in one aspect, you should not be getting credit for hours twice. So again, it's on top of those provisional hours. You cannot be stating, well, I went to a 2-day workshop, I want to count those towards my 1,600 hours. No, that's not appropriate. We had another question about if a person is attending multi-day international conferences in 1 year, can they count them to the next year? No, the time period is April 1st to March 31st the following year. How does the parental leave exemption work if you're on parental leave for 18 months? The parental leave exemption for the college is 12 months, and we are reflecting that as when you claim your practice permit parental leave status, that is the 12-month period that that's being recognized by the college. Someone talked about the area of, in the age of virtual interact. How would you achieve interaction with other psychologists when you are a sole practitioner working away from home? That's a good point about sole practitioners. We know that being a sole practitioner is one risk for professional misconduct. What the research suggests is that social isolation and that's including professional isolation, puts you at a higher risk for professional misconduct. Part of the reason for having our professional engagement quadrant is specifically because of this, to address the issue of engagement and social collaboration with your colleagues. One person asked about going on sabbatical. Am I exempt from CCP? No, you're not exempt for CCP when you have an active practice permit. Any more questions that we're just trying to look at which ones are the most common ones?
Richard, the question comes up quite a bit around if I'm teaching a course and I work at a university, does that count? Right? Or if I do supervision as part of my employment at an organization, can I count the supervision hours I'm offering in continuing competence?
So run that by me again, the last part of that, Dina, please.
Sure. So if your job is to do something, if your job is to teach psychology, or if your job is to supervise, can you count those hours as part of CCP?
No, what we're looking for is something above and beyond. We're typically looking for something above and beyond. However, if you're attending, let's say, a 2-day workshop on the administration of a new version of a test, that could count because it's enhancing your practice. However, day-to-day activities typically aren't viewed as, so if I supervise in my job as a manager at a health clinic, can I count all those hours as consultation with colleagues? What we really see is CCP should be value added. It should be seen as adding value to you as a professional and as a practicing psychologist. What we want people to do is to stretch in their learning. to look for new opportunities to gain knowledge and to be part of the profession.
Thanks, Richard. Another question I think I've been answering quite a bit through the emails for the last couple of weeks is, does it matter if my hours are paid or unpaid? So if my employer is sending me to a training, can I still count that? Or yeah, does it have to be volunteer work, or can it be part of my work? Yeah.
It can be part of your work. It doesn't really matter. So if that's a benefit of your work environment, that someone is paying you to go to a workshop, that's perfectly acceptable to count that workshop. But again, we want individuals to stress, but generally they're taking that workshop, they're benefiting from that. And one of the reasons we did talk, there's one of the questions that's talking about CE. We don't have in our program a CE requirement in terms of a CE approved course that meets APA or CPA's CE requirements, but we do have an hourly requirement as a benchmark for the program, so that you can use that hour similar to how you would use a CE credit.
Fabulous. I'm getting some other questions here, frequent questions. Maybe I'll just name them. You will have the opportunity. So steps 1 and 2 need to be done before you register and pay for your practice permit renewal for April
Correct.
1st. Please know that once April 1st comes, you will be able to go in and edit and modify your continuing competence program. We have a section there that shows that goals may be discontinued. Maybe you choose a different area of focus in your career, and people discontinue goals for a variety of reasons. So please don't hesitate to modify your continuing competence program throughout the year. We would just like you to have a good idea and to set that intention early on in the year as part of the practice permit renewal. Other questions that are jumping out at you, Richard?
There were a couple of questions about when a person's on compassionate leave or medical leave, do they need to participate in continuing competence program? Well, each one of those will be adjudicated on their own. So we will look at the person's context. If they're simply away from work for 3 weeks, they'll still have the remainder of the year to do their CCP. However, if they've left their employment for a year to care for an elderly parent, that would be considered on the own context. So we are going to evaluate each of those on the basis of their context and the framework of reasonableness.
Fantastic. Richard, I'm noticing we've got still a full house, and maybe 5 more minutes before we take a break and move to your and Dr. Jansen's presentation. Is there any last words that you want to offer on this continuing competence program?
Yes, we'll be looking at all your questions that you put in the chat box, and so the most frequently questions, we'll add them to our FAQs on CCP. So again, look to the website. That should be your go-to place for information. If it's not on the website, you can submit the question to professional guidance. And again, we will be tracking those questions, and we will be attempting to answer them. However, before you reach out to the college, we really want you to look at the website. We want to have a fulsome website. We want that website to be available and up to date and provide you with the information you need. So please check there before you contact the college. That way we can continually improve the website and provide the most up-to-date and current information for all members. Thank you, Dina.
Fabulous. The last thing, Richard, sorry, that they're jumping in at is few questions about auditing. Did you want to just touch on that for a few seconds, or did you want to transition? I'll leave that to you.
Well, we can talk about the audit. First of all, again, the audit will be based on reasonableness, and the initial audit will be is you will have to complete the steps of the CCP 1 and 2 before you can get your practice permit for the upcoming year. And again, it's based upon renewal, so you'll have to be in the 2nd year in order to require to put in your hours that you've accumulated. But the first audit will be simply done digitally by the computer. Did you complete the program, and did you sign the declaration that it is completed? And then the system will check: do you have enough hours? Are the appropriate areas filled out. The second level will be done by administration within CAP internally, where the plan will be select a number based upon a random system so that everybody will be audited at least once every 5 years will be done. And that will be done to check to see if that profile is done. Now, in that administrative audit, those profiles or CAP CCP program responses that look out of the ordinary, they will be flagged to a higher level where a professional review those, or the committee will be review those. So they will get a look by a psychologist who will look to determine if they're reasonable and fulsome. So that will be the audit process. Again, we're looking at this upcoming year as a pilot where everybody will be learning along with members. And then that will also be true of the following year. And we will make adjustments and evolve the program with information from our members and their participation.
Excellent, thank you. Well, I'm going to sign off. I just wanted to say thank you to everybody who came out tonight. This has been fantastic. I know that Dr. Jansen and Dr. Spellasi have a whole lot more to go through with you. So I wish you all well. And again, please don't hesitate to reach out to the CAP webpage.
Thank you very much, Dina. And now we're going to go into the second half of today's town hall meeting. This is directed towards supervision plans. So for those who signed in for the continuing competence program, this is a probably appropriate time for you to leave. But for provisional psychologists who want to know how to utilize the MMS program to make changes to their supervision plans, this is a good opportunity for you to learn how to do that. So throughout the year that you have changes that arise in your supervision plan, that you can put those changes into the system directly and where they can be reviewed by the college and approved. Again, for those who are just joining us, we did provide an earlier acknowledgement of the land with respect to treaties 4, 6, 7, and 8, and 10, as well as many unsigned treaties and the ancestral territory of many diverse peoples. Namely, these are the Kainai, Piikani, Siksika, Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, Tsuut'ina, Inuit, and Métis Nation. We also acknowledge and give thanks to the many First Nations and Inuit peoples who have lived on the land and cared for it for generations, and many others, histories, languages, and cultures who continue to influence our vibrant community. We are also dedicated to ensuring the spirit of all treaties are honored and respected. We make this acknowledgement as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. Now I'd like to just introduce the supervision part of our program. Traditionally, supervision plans were held outside of our main legacy database. Supervision plans were downloaded by members and submitted to CAP. Upon approval, they were scanned into a PDF and attached to a regular member's file. Importantly, and often they required revisions to address missing or incorrect information. These processes were both time-consuming and labor-intensive. They often required extensive correspondence and back and forth with applicants. This led to processing delays. The new MMS will allow for applicants to interact with their plans electronically and for CAP to approve, conditionally approve, or seek modifications in a more seamless manner. It will also allow for regular members to make minor modifications in real time without seeking the approval of the college. To discuss these changes in details, I would like to turn this part of the evening's town hall meeting over to Dr. Troy Jansen. He currently serves as a CAP as the Deputy Registrar and Complaints Director. Dr. Jansen has worked in the areas of assessment intervention with children and families in hospital, school, and private practice settings for over 2 decades. He also has extensive experience working in and for Indigenous communities, providing both clinical and programming expertise. From 2009 to 2017, he served as the University of Alberta Department of Educational Psychology Clinical Supervisor and Practicum Coordinator for the CPA Accredited School and Clinical Child Psychology Program. He continues to serve as an adjunct assistant professor in the same program. Prior to the U of A, Dr. Jansen was chair of the psychology department at Taylor University College, where he helps establish an undergraduate program. Over to you, Dr. Jansen.
Well, thank you, Dr. Spellasi, and welcome to all of you who are hanging in there for this part of the town hall. I'd like to Thank also all of the registration team here at the college who've been working diligently over the last number of months behind the scenes to try to get this part of our member management system ready. And today I just want to outline some of the more significant things that you need to pay attention to. And I'll also do a short demo for those of you who are provisionals, but this also has relevance for those who may be supervisors as well, as we often had some questions in the prior town hall from supervisors about how the new system works and what their role as supervisors will be in interacting with the new system. So the first point I want to make in this is that filling in a supervision plan on the new system is relatively easy and straightforward. And it can be done all online, and it can be done using an iPad or an iPhone or any kind of other device. And so it really has been incredibly simplified. Gone are now the days of paper submissions. And I think that most people will find this much easier to use. We've also, we put together 3 how-to videos, one for brand new applicants who are about to enter into the journey of being a provisional psychologist, who have to enter a plan in for the first time. One short video on relatively simple and easy changes you can make that don't require CAPS approval. And then the more complex video, which takes a little more time, I think it's 10 minutes in length, will explain a little more on how you make changes that will require CAPS approval prior to those changes being in effect. Pardon me. So supervisors in any situation, when they're listed in the new system, can be listed as either a primary or secondary. And it's possible for a provisional psychologist to have more than one primary supervisor, in the sense that one supervisor is primarily responsible for, say, your assessment, and another might be primarily responsible for your intervention development or other combinations thereof. And so we've made it easy for provisionals to identify whether their supervisor is playing a primary or secondary role. But what is perhaps a little bit newer in terms of perspective in the new system to keep in mind is that for us at CAP, primary means that that person will be doing some form of evaluation of the provisional over the course of the development of their seeking hours of practice. So if you identify them as primary, our expectation is that they will be doing some form of evaluation of you. They're also, when you enter your plans, as you will soon discover if you haven't already looked at those plans, you will notice that provisionals will list all the supervisors for their plan first in a numbered list. Now, those numbers are important for a couple of reasons for you provisionals. One, later in the supervision plan, you'll be referring to your supervisors by their number in the list. But in the first instance, you will be listing each supervisor that'll be doing some supervision of you over the course of the next year or more, and you'll put them in a numbered list. So the first thing I'll mention is that the number 1 person in your list is generally should be the person that you would see as having the majority or overall responsibility for your plan. They're the person that we would expect that we could contact if we had questions about the plan. And so they might be the one that does the most of the coordination. We want you to think of it as having a point person, and that while you may have multiple supervisors, there is an expectation that supervisors will generally have some form of communication and collaboration around your professional development as you progress the provisional status. And so keep that in mind. So the number 1 is overall responsibility. Now that can change over time in terms of plans can change, and we recognize that. But in general, that's true. We want the number 1 person to be who you think of as having overall responsibility. Another major change from the old paper system is that it used to be that provisional psychologists had to submit a separate paper submission of supervision plan for approval for every branch of psychology they wish to gain competence in. For us, a branch is defined by the following kinds of areas: clinical counseling, education, school, health and rehabilitation, forensics, neuropsychology, and industrial organizational are the major branches of psychology. You can identify more than one branch in your provisional plan, but in the new system, we are no longer asking you to put a separate whole plan for each branch. It became too cumbersome in the design to do so. So instead, what we've done is we have now organized the supervision plan on the new Alinity MMS system according to practice activity. Now, when I say practice activity, I'm referring to the following: formal assessment, general assessment, intervention, consultation, research, etc. So now you have to really focus your plans more upon the professional activities. You will still be able to identify the branches through a checkbox, and I'll show how that looks in a moment. And what we would expect and advise is that if you're entering or revising a plan or adding a branch, you will just have to reflect in the text boxes below which are provided for you to provide details of how you're achieving competence in any particular activity or branch. Multiple branches require more description. So you might say in clinical counseling, these are the intervention things I'm going to be focused on. In forensics, these are the interventions, or whatever other branch you happen to choose. So more detail in the text boxes is what we would expect with more branches identified for any particular activity. Also, you will note a major change is that it used to be you'd get one final evaluation for your whole number of hours at the end of your 1,600 hours of supervised practice. Now what we are going to be identifying is an evaluation of each individual activity that you identify in your plan. Some of you identify, say, interventions and general assessment only. Others will add formal assessment or consultation. Some will have all of the 6 different practice activities in your plan. No matter how many activities you have, each activity will be separately evaluated by whoever is primary supervisor for that activity. Now, because many of you supervisees submitted a paper plan long ago and not on the MMS system, we did something what we feel was quite kind for you, which was we hired I'd say an army of temporary staff to help input the several hundred provisional practice supervision plans already for you into the MMS. So for most provisional psychologists, we've already done that work for you, and it was quite a lot of many days of work on the college's side to get those entered. But we did try to simplify it somewhat. One thing we've done is that we've preserved your old paper plans by making them into a PDF copy and placing them in your My Documents in your profile. So you can still see and refer to the original plan, which is still there. But we had to enter the plan as best we could. But with the differences in the new way the plan's entered, we had to make what our best guesses were as to who should be the person evaluating any particular activity, who is the primary. So if they were listed as primary on your paper plan and they had more hours, they generally were listed as the primary for us. Now, if that's not correct, I'll be telling you how to make that change relatively quickly and easily. Although if that supervisor is okay with evaluating that activity and they collaborate with the other people that are on your plan, then maybe they can just stay at it as it is and they'll just evaluate you, is probably the easiest way to deal with that rather than trying to change the supervisor, which will require, changing a primary will always require us to do an approval step. It can be done and it's not that difficult, but I do suggest that you consider carefully whether you're going to do that or not, so that if you have to make a change and someone doesn't want to evaluate that activity, we'll show you how you can do that. And I'll do a bit of a demo today. Okay. One of the key things I wanted to make sure all of you provisionals know, and that this is also for you supervisors, is that one of the fields you'll always enter when you're entering a supervision plan is an anticipated end date. This date is critical. It is critical because it will automatically evoke an evaluation step that is done by the system automatically. So when it reaches that end date on your plan, it will automatically forward to whoever's listed as primary the evaluation and prompt them to evaluate that task and activity. It'll list all other supervisors on your plan and all the information for the supervisor, who will have much the same type of interaction and material that they're used to if they've done supervision before. So it'll look a lot like the old evaluation forms online, and it'll be relatively quick and easy to fill out, save and submit it to us, and then your hours are counted, right? So importantly, if you're getting to an anticipated end date provisionals, and you know you haven't finished the hours, you can amend this date without our approval. You can go in and say, oh, I'm not going to be done by December 31. I think I need 3 more months. I've talked to my supervisor about this and they agree I need 3 more months to get the hours in. You go in, you change it to March or whatever date is appropriate. And it's very easy to do that. And in fact, it's really critical you do that before it reaches the end date. Otherwise, we go through that evaluative step and you can't stop it once it starts. So be aware of that. Importantly, too, that anticipated end date can be a way of making amendments to whoever your primary supervisor is. So if you're ending a period of supervision on an activity with one person and they say, I can't be your primary for whatever reason, maybe they're retiring or they're moving on to BC or some other, greener pastures, and you need to find a new one. You can amend the end date to reflect when your existing supervisor is going to be leaving, and add a new supervision plan with your new primary into the supervision plan relatively easily. And I'll demo a little bit of that. And that's what that third video I mentioned, which is on our website, is meant to do, is to teach you how to do that. So I'd encourage you to look at that if you haven't already. So for those of you who are actively working on your supervision plan, collecting hours, and already have a plan that is approved by us, we've entered it for you. However, those of you who are on Form B or just moved to Form B, that part of our system that form hadn't been developed, but we wanted to make it very simple. I can tell you that form is nearing completion and should be ready very shortly. And so you can expect that if you are in that boat where you are on Form B, that we will be sending a very simple form for you to fill out, which essentially will only ask you to say who will be supervising you now that you're done your 1,600 hours in your LEAP. Because in Form B, all it means is you're moving to a lower ratio of supervision hours required per practice hours. And in fact, the ratio, if you haven't paid attention, the ratio is different. It used to be 1 hour per month. It is now 2 hours per month by council vote. So that is now the new standard. So please note that. But that Form B will be coming out soon. And so there may be some of you who are kind of caught in limbo because we're making the change to the MMS and you've been waiting for us to get that for you. We apologize for that wait, but it's coming very soon. And once that form's in place, it'll all automatically tell you when your next 6-month evaluation is due. But please note, we don't require it anymore. The college are not asking you to produce that to us. On the other hand, you still must do the evaluations, and the evaluation, however they're done, should be put into your supervision record. And because in case we ask for it, we want to know that you're actually regularly reviewing things in meeting. And a critical piece of that is also reviewing your progress and goals towards finishing the last step of your licensure, which is trying to get through that pesky EPPP exam, which we know is no small task. So we want to make sure you stay on track and that you've discussed and had that as included as part of your supervision, ideally. All right. So making changes to plans. Let me share my screen. And for this portion of the thing, I'm going to be pretending to be Mary Ainsworth, a brand new provisional psychologist who is a master's level psychologist. And I'll simply log into the Alinity system. This is actually a test site. It's not the actual site, but it works exactly the same way. So this will enable me to show you a few of the things I've already talked about. And after this brief demo, we'll open the floor for questions and answers and discussion questions that anyone may have. So hopefully this works for me. There we go. And I deliberately decided not to pick someone with like a doctoral level of education and so on, because this often has a few more layers. But you'll see when you open up your profile at the very bottom under my forms, we'll say something like hours of supervised evaluated practice. And you'll notice there's an update button right beside it. In order to make changes to your supervision plan, simply click the update button, and this will open up your supervision plan. There's instructions for how to fill these things out, but in this as example I'm giving you, Mary Ainsworth already had an approved plan by us. But now I want to show you what she would see after the plan is approved. And then I'll show you how you could what kind of things you can change easily without requiring our approval and how you would do that. Now, generally, you're not going to add or change anything to an approved plan in this area. This is usually for those who are submitting something for the first time and let's say have done a pre-doctoral internship. They have to provide some evidences of that in order for us to count that. This section, request for credit, is similar in that some people come to us from other jurisdictions. They may have completed 1,600 hours in that other jurisdiction, and they want to apply for us to count those hours already as they enter in to our jurisdiction. One special note is that we had to make a decision on how to treat all of those who have an existing plan or had already counted hours within our system. How were we going to treat that? What we ended up electing to do, even though it's an unusual situation and not really what this section is for, is that those of you who've had a final evaluation of some portion of hours already in your supervision plan, we put it in request for credit. So we counted it as in that way to make sure that the computer saw those hours as done. Because it wasn't in the computer ahead of time and it wasn't evaluated within the computer system, we had to find a way to keep those hours banked for you so that the next, your live plan now that you're still working on actively is still below that, right? So for some of you, you will have something listed in this section because we counted your prior approved or evaluated hours to date in that section. And that was a sizable portion of provisionals had that. In the actual supervision plan itself, you start with, the first thing is to identify a location. And in this example, we have Mary Ainsworth working at a really great school division as her sample placement. But let's say Mary says, I got an offer to do 0.4 at a private practice or Saturdays and evenings, and I really want to add that to my plan. How do I do that? Well, you can add a new location without having to tell us about it. And it's very simple. You simply click the add button, tell us what you're going to be doing. Now, it's important if you're going to add branches and things that does require an approval step. So as long as it's within the same branches and the same activities already approved, we won't need to know about it necessarily, but we want you to record it where you're going to be doing that. So Mary was doing these 4 activities in ed school. Well, maybe in private practice, she's going to do just formal assessment in ed school formal assessments for a private practitioner. And that's all she wants to do. And it's going to be a, really great. Let's see if I can find it. Maybe I didn't type it in correctly. One of the things that we tried to do is make it simple for you. So it pre-populates things that exist already in our database. So in this case, I've got a really great psychological practice already showing up. So I can just simply collect it and click it. And now I have the address already populated. Now, if you try to enter in a location name that's not in our database and it doesn't show up anything, all you do is enter all the details here. Very simple. If you ever make a mistake, you can trash anything that you didn't like and start over again. So that's as simple as that to add a location. Can I add a supervisor? And I say, if you're adding only secondary supervisors, we don't need to know about it either at the college. Only primary changes require a CAP approval. So if I wanted to add, say, another supervisor to the mix, oops, that didn't work. I'll just click it again. There we go. So now you'll see that I have in Mary's example, number 1 supervisor is Dina Martin. and she's a primary. Number 2 is Troy Jansen, and he's also a primary. But let's say we wanted to add a third person and let's say we wanted to add Dr. Richard Spellasi. You can search by last name or license number, whichever works. They both work. And then you simply collect their name. It'll auto-populate. Please note, your supervisor has to have 5 years experience. If they don't, they won't show up here. That's your clue that you can't use them as your supervisor. Okay. And then you click them as secondary. If I click primary, that would generally require a submission to us so that we can approve them if they're going to do some evaluation of you. We want to know. You have to make all the declarations for every time you add a new supervisor and tell us how they're going to supervise you. And it doesn't, just whatever that you discuss with them. And that's an important principle I want to reemphasize. You should never enter anything that you haven't discussed with the person first. That's an important principle. If you declared that you've talked about it and you didn't, it can be a finding of unprofessional conduct potentially to make a declaration that's false to your college. So just keep that in mind, that it's important that you not put your name on and submit it to us that you haven't actually submitted for approval, or that you haven't talked to that supervisor themselves to make sure they're comfortable doing what you're asking them to do. So that's an important thing we wanted to emphasize in all cases. Now, down here, you'll notice is the plan itself, and this is all the different activities. In Mary's case, she identified 4, so you'll see consultation, you'll see a list of all kinds of information, formal assessment, etc. But you'll also notice that some things are grayed out, and even the add button, I can click it as a million times, won't do anything. Why? Because that part is locked until I make an active step. In order to make a change to any part of the actual plan itself, anything grayed out can't be changed. So in order to make a change, I'd have to first say, yes, I want to make a change. I now can add something, but I couldn't before. But notice this, the activity itself here can't be changed, nor can the branch. You can add more information in, like if I wanted to say add clinical counseling consultation to Mary Ainsworth's plan, I could do that by adding a whole new consultation piece in clinical counseling that I'll submit for approval. It's relatively simple to do this. Another important thing to keep in mind here is that, as I mentioned before, your primary supervisor and your secondary supervisor are in this section denoted by the number in your list. So we remember earlier I showed you Dina was number 1, I was listed number 2, and then we added Richard number 3. You can never make a change to primary here. So if you're going to need to make a change to your primary supervisor, you'll need to do more than identify a yes. You'll actually have to close off that part of the plan that if you're going to make a complete change to primary. And what you do is you simply add today's date, and that will evoke that prior piece being evaluated. And then you add back in a whole new section with a new supervisor. So you'd have to add that supervisor in the list above, and then you'd be able to add all the rest of the details below. So the important piece here to remember is this: to change a primary requires ending telling us that the current piece is ending. And if it's not ending today, put it a month from now or whenever it's ending. That will evoke the evaluation step that gives you time to add and get approved your new piece, line up a new supervisor, and tell us and submit it to us for approval so that we can approve it, and then it begins without any kind of delays. And that's what we would generally recommend you do, is make sure that when you can, you notify us as soon as possible. You make that change as quickly as you can, because it's important to give us some time, because we need, registration committee needs time to review certain things like this. Okay. I think that's pretty much covers most things. Some people have asked me, well, wait a minute, can I add pieces of the same thing? Yes, you can. If you just wanted to say, well, actually, I just wanted to do 300 hours, you can change the hours though, telling us that doesn't require approval, but you have to make sure your supervision hours are in the right ratio. So if you're going to add that, you better make sure that's up at least at the minimum ratio as well. Okay. Let's say you want to add a population. we don't require approval of this, but I would say if you're going to do everything, your supervisor should be talked to. They should say, yes, I can supervise you to work with kids or families or couples or whatever you're choosing. You can't just say anything goes. It must be something you have enough training for, your supervisor feels comfortable and competent to train you in, and then you can add it. And we are trusting that is being dialogued between you and your supervisor. That simply clicking it doesn't make it true. We have an expectation, and if you ever get called on a concern to my office in the complaints, we'll check those things to make sure that was actually verified. And it can be really serious to misrepresent something or not have dialogue with your supervisor before you make that change. On the other hand, we're not going to be checking the population piece for approval. Okay. You can also make changes to text box information as much as you wish. And it's relatively easy to do. You can see this is just a sample. So the details are very, very small and not that many. Obviously, you will put much more detail. We'll be putting sample plans up on our website eventually. They're not currently prepared, but we will be getting some of those out so that you can kind of see a more model of the kind of level of text detail that might be appropriate for us to approve certain types of activities. All right, you always tell us when you start, when you end. The midterm evaluation point is good just to keep in mind, and if you're going to have any planned absences for any reason, there's a place to mark that down. And so we have a lot of information here, but it's relatively simple and straightforward. As Dina mentioned earlier, if you want to make changes, don't click submit unless you're absolutely sure you want us reviewing it, that you've looked at it, you verified that the information is correct. That's when you submit, and only then. But you can always save it for later, work on it a little bit, save it for later, come back, tweak it a bit more, make sure you got it right, and then click that button. Obviously, you don't want to click withdraw. That's a pretty significant thing. If you're completely withdrawing a plan, you're going to have to start completely over. So don't click withdraw. It is available for rare circumstances only. So the main one is click save for later. Please note that we have a log of actual hours completed, and it's optional. Most of you are using Excel spreadsheets or some or the like to keep track of your hours. That's sufficient. There are sample logs online, but this log requires you get on every month on the system to track your hours, and that's possible to do. If you want to take advantage of that and learn how to use that, that is possible. There are some good and beneficial things on this way of doing it because it's right in your system. It's always on your profile. But on the other hand, it has less versatility than, say, what you can do in an Excel spreadsheet of tracking your hours, keeping track of fields and dates, etc. So it's up to your decision. We're keeping this optional. So that's it for me. I'm going to stop sharing and see, ask Richard to chime back in and see if any questions have come up.
Thank you very much, Troy. As noted by Dr. Jansen, CAP is in the process of finalizing several additional resources that will be available on the CAP website. His presentation will be recorded and available on the website if you want to reflect on it, or if you want to review it to obtain some additional information or reinforce what you heard. So Dr. Jansen is willing to respond to some questions. So I think we'll go to that. Go to those questions. One question was, Troy, for their new location, can the provisional add working via telehealth if it's not connected to a clinic or agency?
Well, that's a good question. I mean, the critical piece is that you're being supervised for any kind of activity you're doing. So whether it's through telehealth or not. Now, who's responsible for the work you're doing via telehealth, and what is their training and comfort to sort of supervise you is a more important question than identifying a specific location. But if it's tied, if that telehealth practice is tied specifically, let's say, to someone's private practice, and it's being advertised through that practice, it probably still is a useful thing to identify that you're connected in some way to that location, even if it's virtually, because you're still technically have a professional relationship with that location. So I think it'd still be appropriate if your telehealth is being done via supervision through a person at a location, being advertised for that location, that you tell us that location or you record it somewhere. But that would be, just to accurately reflect where you have ties in your work, in your location and work, because sometimes telehealth might morph into actual physical practice at a later date. And so it saves you time to sort of tell us that location ahead of time is the way I would think about it. I don't know what you would say, Dr. Spellasi.
No, I think you're quite correct, Dr. Jansen. I think the issue here is, and COVID did require us to be a bit more flexible, is that provisional psychologists should not have an independent telehealth practice. That they're required to be practicing within a group or an organization, and that is where it's really important to have that location or that psychology group identified as where that location is. I do have some more questions, Dr. Jansen. I realized that once we enter the information in the supervision plan in MyCap and submitted it, we can't do any changes to it. So we need to email the college if there is a change before the meeting date. Is that correct?
Yeah, that's why it's so critical that you don't click submit if you don't know for sure that your details are changed. And and now you're gonna have to wait for us to approve something. But yeah, you could email and say, oh, I goofed, I made a mistake, I listed this person when it's that person, or there's some sort of thing like that. We might have to send it back to you, and say, please make the changes you need to and resubmit it. And this is why it's so critical that that you only click submit when you're absolutely sure it's fully done and ready. It's like submitting an application for grad school. I hope you didn't submit it and then say, oops, I forgot to add all my references. We want to make sure you're done. But I know it's a new system, so we're being certainly trying to be understanding and try to be supportive of changes that need to be made. And I know that our staff are still working on how to help you with that part, because we're still learning our processes with how to process these things, because it has to be done now within the computer system. But we should be able to make those changes relatively easy, and we'll be giving you better advice once we look at how the best way to do that. We're trying to make sure we're doing that efficiently for you and us. But yeah, it's locked out for you if you've submitted it, and we can't change it until after it's approved or not approved. So.
One person issued this question, Dr. Jansen. My supervisor did not receive the evaluation form, even with the date prompting by the automated system. I think I can answer that, is that those evaluation forms are available on the CAP website, and the supervisor can simply get an evaluation form from that website. Another question is, their end date is this month, but they haven't been able to do this even though they contacted CAP at the end of August. They were asked to wait and then log in and change it, and have been unable to add in their end date on their supervision plan.
So what they're saying, I think if I read this correctly, is that they intended to end at the end of August, but because we were in transition, that they weren't able to get it evaluated. And now here we are in December, and you're still waiting to change that. Now it should have been possible October 1st, actually, to get in and make that change. And by the way, Richard, the evaluation forms are not on the website. It should have been sent to you. So if the evaluation form didn't go to your supervisor directly, either we have incorrect, or your supervisor may not have their correct contact information on our new system. If that's the case, they've gotten the email to whatever email they have on our system. So my guess is that they haven't updated their email system, or they send it to an email they don't check anymore, something like that. Encourage them to update their email system. Maybe we can adjust that, and so that, because it should have gone directly to your supervisor for the prior question. For this question, you should have access, and you should have had access on October 1st. And if that's not the case, you can maybe contact us, because you might be one of those that are in the Form B camp, so that you finished it all, and we know you finished it, and you were just waiting for an evaluation, and everything's done except for maybe the EPPP. If you're that boat, the Form B is coming, and then all we need to know is who your supervisor is, and everything it'll allow you to access the EPPP and apply for it, and will count your hours as done automatically. So we were trying to simplify that step for those of you who were done. So you might have just been in that sort of mix, and we apologize for the stress that we know that can create a lot of stress for you. And we don't want to take that lightly, because we know that you're waiting and wondering, where am I at? I'm in limbo. And, we want to make sure we get that out to you soon. But don't worry, you're on track, and we are keeping track of all those, but we will make sure that you get that. If you're in that Form B camp, you'll be getting that form, I hope, very shortly. I don't have exact timelines for you. I just know that I saw the Form B first, that already a sample of it. So we know it's nearing final approval, and then it's going to be available, and we'll send it to all of those that were impacted by it. There were several hundred of you. And for those of you who may not see in a supervision plan, because you're in that boat. And so if we got a paper evaluation for you, we count your hours as done. We just may not have notified that in the transition. And so our hope was to get that Form B out quicker, but we think that'll be out before Christmas time.
Okay, there's a question here about I completed a new supervision plan with a new system for a potential provisional. Is there a way for a copy to be sent to the supervisor, since we are going in blind with what is in the plan? Or is there a way, even better way, to approve it from a supervisor perspective?
Yeah, so one of the things that, like Dina suggested in prepping for your CCP and creating the text part of the plan ahead of time in, say, Word, in a Word document, so you can simply cut and paste it when you're jumping in to log into your actual plan, so that when you're ready, and then making sure your supervisor sees that is one way of doing that. Another way could be to print screen, and it should be possible to print a lot of that information directly while you're in the Alinity program. I don't think there's a current way to export your supervision plan draft. And I'll check into our tech people to see if there's a way to do that, because I don't know the answer to that right now. Maybe Lindsay, who's also monitoring, knows the answer to that. I don't think there is. I think that she's confirming that with me. So, so the best solution is to print screen, share it with, when you click save for later, you're not submitting it to us. So you can save it for later, print screen, send it to your supervisor. That's one way. But I would always create my text in a different document, in a Word document. So I have a preservation of it for myself, and check it, because you can then just cut and paste it into the text box in one step, you're done. So you're not wasting a lot of time on the actual system. And that way your supervisor can see all the plans and approve it, right? That's the critical pieces. Make sure that you're clearing with them the branches, their competence as well.
So I think you answered this question before, Dr. Jansen. Does the evaluation get sent to supervisors automatically?
Yes.
If we have submitted our plan for revisions but need to make additional changes, how can we go about this, as I no longer have access to make changes online?
I don't know what they mean. They might need to contact us if they say they no longer have access. There should always be access to your profile. But if the plan is in a submission process and waiting for an approval, it needs to be approved, and it won't be accessible to you again until it's been approved. Once it's approved, or we might approve it with comments to you saying, we're confused by what you're doing, tell us and give you more information. And our staff has the ability to import comments to you right within the Alinity system, right within your plan itself, so that you can see if there's a comment to you. And you can respond to that in kind and when you do resubmission. So if you're not accessing the system, it's because you've submitted something, probably, as my guess, and you're waiting for us to process it. I don't believe we have a ton of things waiting in the queue, but I haven't checked with registration today, so I'm not sure how many are in the queue. But I think we've been pretty efficient with getting through those lately. And I know Dr. Spellasi has been greatly assisting in the last number of months with helping process registration approvals so that we can get them more quickly done. And that's still going to be the case for the next short while, so that we can process these hopefully relatively minor changes relatively quickly.
Yes, that's correct, Dr. Jansen. I processed about 15 supervision plans today. I have a question from a supervisor. I'll let you answer it, but I believe I could also answer it as well. I have looked but cannot seem to find the supervisor's final evaluation form. Is it triggered by the end date in the supervision plan?
Yes. The answer is yes. It's triggered by the end date, and then the primary supervisor only is sent that. We don't ask for supervision evaluations from the secondaries. And our expectation is that if there's multiple supervisors for any activity, they talk to one another. And so that the primary is giving a collective evaluation of all supervisors. That would be our expectation. We trust that that is the best practice and therefore what most people are doing. And we'd certainly encourage and steer you towards best practice in this area.
And there was a follow-up question, but I believe Lindsay is also typing an answer. But if the supervisor supervision finishes early, can the provisional go in and change the end date so that the final evaluation is triggered?
Yes, absolutely, and easily. So yeah, if you're done, let's say you were done a little while ago and you just haven't gone in to change it as soon as you can is what I'd say, because otherwise, until it's evaluated or you've approved a new part of your supervision, we don't know about it. It can't be counted, right? So it's really important you get in there now that it's live. And we recognize there's been a few of you caught in that sort of transitionary period where we were making the switch from the old to the new system. But for most of you, yeah, get in there and make that change. It's relatively easy to make that change. Just make sure you click save, right? You make the end date change and save it. If you don't save it, nothing happens. So you have to save it, right? And you can change the end date without submitting it. You can save it, and it should evoke that step within a short time of that date.
Okay. This person said, if you're already registered and have submitted a supervision plan for a new area, such as formal assessment, you would like to gain competency in, is it still the same process to follow? Have those supervision plans also been transferred to the new system?
Well, I'm not exactly sure I'm following that question, Richard, but so when let's say you've submitted a plan and it's been approved, but you didn't put formal assessment in the original plan, so it's not approved. In order to add an activity, you must get it approved. So you'll have to go into your plan, say, yes, I want to make changes, click the add button, add formal assessment and all the details you need, who's supervising you, when your start and end date, where it's happening, what branches, and who's going to evaluate you. And then submit it so that we will review and say, yeah, that you're good for that formal assessment piece or not.
Yes, I probably would interpret that question a little bit differently, Dr. Jansen.
Okay.
I think it might be that they have completed their supervision, their 1,600 hours. They're already fully registered, and now they want to add a new area.
Yeah, no, we're unfortunately fully registered psychologists do not have access to the supervision plan, so that they can't add a supervision plan at all on the Alinity system. So they're going to have to use the old paper-based submission to us if they want to add, say, formal assessment as a new area of practice, and then that gets reviewed by paper right now. So that could change as we. The beauty of this system is that there are ways to customize, and we are taking a look. We're going to use this first full year as an evaluation of how that's working, and we might have wish lists of things that we could possibly add some functionality to, but some are more difficult changes than others to customize. So for now, we're going to stick with submit it by paper. Maybe we'll put something on our website for if you need to add a new practice activity, which is the language we're using. For formal assessment is an activity by the way the plan outlines it. Then it's paper-based. And just have to have sufficient detail, much like you would in a supervision plan, so that it can be evaluated and improved, so you can count it. And remember, if you're adding an activity like formal assessment, minimum 400 hours, right? That's the expectation for an activity like that. Similar for interventions. Other activities probably, are less critical to add, but, because it may arguably, but, in any case, I think you add them by paper for fully registered.
Okay, this next question is, does the person have to have their credentials approved before they are able to see the supervision plan on the portal?
I believe the answer of that is yes. Lindsay, correct me if I'm wrong if you're listening, but I believe that the answer is yes. You first have to have had your credentials approved. Yes, she's confirmed that. Thank you. So before you can have that, and in fact, once your credentials are approved, a CAP staff member will send a form to you that will allow you to begin filling in your supervision plan. And before that, you can't. So you have it is sequential. You must first get credentials approved, then we'll send you the supervision plan document that'll allow you to begin entering it. And you follow all the same steps that I've mentioned. And there's a video how to enter a plan online for those that are new applicants.
Okay, Dr. Jansen, I'm not sure if you know this answer to this question. The person's asking, where can they find the registration verification part 1 form? They only saw the part 2 form on the website.
Good question. And again, I'd turn to, maybe Lindsay knows the answer to this question. I don't know exactly where it is. Part 1 is part of the provisional application. So you'd have to look in the provisional application form is where I guess where you'd look at it.
Troy, I can answer this. So
thank you, Lindsay.
The registration verification used to be combined part 1 and 2, but part 1 is now part of when you're applying for provisional status, because that's all the declarations that you have to make about your fitness to practice and those kinds of things. Part 2 is strictly if you are registered in another jurisdiction, then you must have part 2 sent directly to CAP from the licensing body where you are registered.
Perfect. Thank you, Lindsay. I'm glad you were here to answer that question.
Right. I'm just seeing if there's any other questions that could be answered. The question is, are you asking supervisors to complete a declaration for supervision along with a person's supervision plan, or is the provisional filling out those questions for the supervisor as you have presented herein?
No, yeah, it's the provisional that makes the declaration. Obviously, they're held to account for that. Now, there isn't a way for the supervisor to log in as the provisional and see the form, and so we saw no easy way for that declaration to happen. So we're asking the supervisee, rather, the provisional to confer with their supervisor, say, I'm going to declare you as competent and willing and able. Are you good with that? Yep, I'm good with that. You will tell them, hopefully, and they will make their declarations honestly that they have done so. So yeah, some people have expressed concerns to us. What if they put my name down and I haven't actually talked to them? And I go, well, could become a complaint, a formal complaint, because you must not misrepresent information to your regulatory body. And that is listed in the Health Professions Act as potentially being unprofessional conduct. So I'm again reinforcing that. You're on your honesty, and we expect people to be honest. So we're not going to be policing that. But we are, if we discover that something was done dishonestly, and as soon as you find out, you can let us know and we'll look into the matter. We may not do that through a formal process, but we, in terms of how we respond to it, but we would certainly emphasize the importance of being honest with the regulatory body at all times. And that's what the declarations are there for, to make sure that they've done what we expect them to do, which is to talk to you as supervisors, and vice versa. And actually, the ownership really is on the supervisors more in terms of making sure that a dialogue has happened if you're entering into a supervisory relationship. The responsibilities are higher for the supervisor, I would argue, given that you have a higher power position in that relationship. But, obviously it's a dialogue, it's a relationship. So we would expect you would enter into that as you would any other, which means through conversation and meeting with one another, discussing in various different ways. I hope that answers that.
Here's a question here. as a supervisor, is there somewhere I can review active supervision plans of my provisional supervisees, or is access to the plans themselves only available to the provisional psychologist? In the paper process, I hold a copy of their supervision plan and can review as needed.
Well, the PDF on My Documents can be of the paper plans that we've uploaded to all the existing provisionals. Those are still accessible. And once we've approved the 1,600 hours of a provisionals plan, that becomes a new PDF in their My Documents. The provisional can share that with whom they wish. They can open it, provide a copy, email it to you. And so you can request that and say, can you provide me a copy once it's available so I can keep an accurate record? The other thing is, as I mentioned, asking for information ahead of time so that you keep some record of what you approved as a plan, what your understanding of that was, so that it doesn't get tweaked or changed without your knowledge. And then you're going to go, wait a minute, that's not what I signed off on. That's what I would do, is ask for that Word copy or whatever, rough copy, draft copy, the screenshot printed, whatever they give you, and whatever you prefer. And you can ask them to produce whatever you'd like, to sort of say, I want to keep a copy of the plan. And I think that's a wise course of action as a supervisor. I would always want a copy as well, and of at least the core pieces of that, just so that I have something to reference to say, well, we agreed to do this. So no, I see we haven't added the following, this 6 or 7 assessment tools. And let's talk about that. Is that something we want to set as a goal here now that we're at midway, or whatever, right? That's appropriate. So yeah, I agree. Finding a way to get that is good. Make it your provisional's responsibility to find a way to get it to you. And there are multiple right ways to do that. So hopefully that helps you to know that it's possible. It's just not automatic. You can't go into someone's private profile and access it for obvious reasons. So, but they can share it with you and probably should.
Okay. Here's a question. Are there some timeline for the completion of Plan B, waiting for the final review? I'm not sure about that question, Troy. I'm not sure if you understand that question.
Did they mean Form B? Form B, I think it must mean Form B.
I think they must mean Form B.
Yeah, so the final evaluation, so the final form for Form B is fairly simple. And because there's no reality to Form B other than you've changed the ratio of supervision. Everything else is the same. There still must be supervised, correct, right? And the ratio is lower. That's it. That's the only thing difference in Form B, is that your ratio of supervision is lower and that your only remaining requirement is the EPPP exam and passing that. So, usually we've had an evaluation that says you're relatively independent now, but you still have to be supervised no matter what. And so we need a form that says who your supervisors are. We'll prompt you for your next midterm so that you're keeping honest with the, and on your goals of your professional goals, because we want all of you to get done, as much as you do. We really do. We want to see you succeed in finding time to plan and prep for your exam, as well as continuing to develop your professional skills.
Yes, I think I would only add to that, Dr. Jansen, is that while you're on Form B, your clinical correspondence, particularly psychological assessments, must be countersigned by your supervisor. So it's really important to ensure that supervisor is still reviewing and attesting to your work in terms of formal assessments as well as clinical correspondence. Here's a question, Troy. I am switching my secondary supervisor to my primary. I will need a longer period of time to be competent in one area. Can I still count, in that area's assessment, can I still count my assessment psychology hours towards my 1,600 hours, or do I just count the hours for my 400 hours that my initial primary supervisor was supervising?
That sounds like a complex question. I'm not sure I was necessarily following all of that, but I think what they're trying to say is that what I heard is that they're continuing on and they're not quite determined to be competent. They have to continue with hours, and they're wondering, should they evaluate and close out a piece of that even though they're not ready? Or so there's two options. One is, if you haven't reached your anticipated end date, bump the end date later and just keep that formal assessment part alive for another 3 months to add or whatever you need to make sure you have enough hours in that your supervisor will sign off on. That's certainly available to you. If the end date's come and gone and it got evaluated, you'll have to add a new piece, and they'll evaluate you as not ready, and you'll add a new. You'll go in and say, "Yes, I want to make changes." You'll add formal assessment. You'll say what the next part of your formal assessment training is going to be that will round out your competence, so that they'll be able to judge you as ready at that point. I hope that makes sense. And if not, give us a call. And Lindsay reminded me that they can contact us at communications@cap.ab.ca. If they have questions related to supervision plans, Lindsay or I or someone in registration would be glad to help any individual questions that are more complex. And we're hoping to develop an FAQ document as we go here, because we know there'll be those questions.
One supervisor said if they could not give 2 hours supervision in a month due to unforeseen circumstances, how can they compensate these hours? And I think we would be saying the same thing, Troy, that if a person is not able to fulfill their obligations as a supervisor, likely it would be best for the provisional to add a secondary supervisor who can support supervision of that provisional when their supervisor is unavailable. One person also wrote about supervisors' access to the plan online and have some way to agree to changes. I think that is, again, what you'd mentioned, Dr. Jansen, that there is an expectation that the supervisee will share their current supervision plan and any changes with their supervisor. And it's appropriate for the supervisor to say, can you give me a copy of your current plan that is on file with the college? But again, because of privacy issues, it would be incumbent upon the provisional to share that plan anytime the supervisor asks for it.
In fact, if you were willing, provisional, like I did in this Zoom meeting, and most of you have adopted virtual technology, you could have, if you have multiple screens like we do, which is really handy for this, you can share your screen, open up your Alinity profile, walk your supervisor through everything you've entered, and so they can see it live with you, discuss it in dialogue as you make tweaks or changes, and then click and maybe when you're like almost ready for submission, that might be a good process. Maybe you go through it with them live and virtually, and when COVID's done, maybe you'll actually sit with them and you'll have your laptop and you'll show them what you're doing. And that's another way to do it. And I don't know if it matters to us what way you do that, but there are multiple right ways to make sure you're sharing and that you've collaborated on an approved plan, because it has to be approved by your supervisor. They have to be privy to it for that reason. Their name is associated with it. So.
Yes, and there were a couple of other people who responded about possible concerns about not having access to that supervision plan. But again, the provisional must make a declaration that they have reviewed this plan with their supervisor. So it is, again, as Dr. Jansen noted in his preliminary remarks, that if the provisional is making attestation that they have reviewed this plan with their supervisor, and in fact they haven't, that could be a referral to the complaints director for an investigation into possible professional misconduct. Another question here, if you're adding a revision on the supervision plan that does not require a CAP review, do we add the change and click save for later, or do we still press submit?
No, don't click submit to things that don't require approval. The grayed out sections are the ones that require approval. And if you're not making those changes, if you're just adding a location or a secondary, adding a population, just click save for later. Don't click submit for things that don't require approval. Submit is reserved for only those things that require approval. New activity, change of primary, change in or adding a branch, all of those require approval still. Those, if you make that change, yes, you click submit. If it's those other things, we don't need you to just click save for later, and it's saved for your records, and that's fine.
Okay, I think we have time for two more questions, Dr. Jansen. One is, if they've completed all the requirements and just waiting for final review by the registrar, based on the answer, I should be on Plan B for this type of Plan B. Is there some timeline to move to the next stage? Do I need to submit the Form B evaluation at the same time? So I think what they're suggesting is there a time limit, a timeline for final approval once they've completed all the requirements? I think there's typically that's done in fairly short order, and we are currently not waiting necessarily for the committee dates that if it's coming in and all the information is available, often that's reviewed before the committee dates, but it's typically reviewed. We have multiple meetings a year scheduled, and so those will happen within short order for you to receive your full registration status. There is one other question. If a supervisor is an external supervisor, not on site, is a consent for supervisor access to information form still required? And will there be a space for adding this documentation online?
Right. Yeah, I don't think we currently have a request for access documentation, but what we do recommend is that you achieve that kind of consent. I believe the old form might still be accessible on our website, Richard, but I'd have to check that or check with Lindsay on that. But if it is not, it's still important. The important principle here is that external supervisors need to have access to review your record keeping practices as part of your professional development. And that's the main principle behind making sure that they have had consent for that level of access. And that is why that's still an important step to go through. But right now in the Alinity system, there is no current forms for that that I am aware of.
Okay, and I have time for one last question. They recently completed a supervisor's final evaluation Form A about a supervisee and signed the form and hit submit. My assumption was that the form would then be sent to the supervisee to sign it. Was that a correct assumption, or was I expected to enter the supervisee's name on their behalf?
If you get automatically emailed an evaluation from our system, the supervisee's name's right at the very top of the screen, and it's auto-populated, and so if you really look carefully, I think it's in the top right or top left. I'm not sure exactly, but my recollection is that the name is already there. The principle is that you should have talked to them about, here's what I plan to do for your evaluation, and they should know what you're planning to do, because you're declaring on your evaluation that you've reviewed it with them. And so for supervisors, you still have to review your supervisory evaluation prior to submitting it to us. So make sure you've done that, much the same as it's the supervisee's responsibility to review their supervision plan with you. So it goes both ways, right? So yeah, if you click submit, that's fine. I mean, but and if you didn't review it with them, make sure you have now as soon as possible is our recommendation, because that's our expectation, is that you only evaluate things, give us evaluation comments and evaluation forms that you've filled in that you've reviewed with your supervisee.
Okay, well, thank you very much, Dr. Jansen. It is now 7 o'clock. So I would like to thank everyone who has submitted questions and who also has attended this presentation. For those who were not able to get their answer today, they can submit it through the communications link at the college, and someone would be happy to respond to your question. Again, please check the website for information prior to contacting the college to ensure that that information is not available from the website. But if upon reviewing that you still have questions, please submit a question to us directly, and we'll endeavor to answer it as quickly as we can. So thank you again for attending tonight's presentation. And if you still have further questions, please join us in January for the final town hall meeting. Thank you very much.
Thanks, everyone.